If your pet's kidney values come back high, it can feel really scary, but it doesn't always mean kidney failure. I'm Dr. K, and this is Inside Pet Medicine. I'm a practicing veterinarian, and I see this all the time. Lab results that sound alarming, but aren't always what they seem. So, let's break this down in a way that actually makes sense. When we talk about kidney values, we're usually talking about BUN and creatinine. These are waste products that the body normally filters out through the kidneys to be discarded in the urine. Creatinine is a waste product from skeletal muscle, and BUN is a waste product from protein breakdown. When the kidneys aren't filtering as efficiently, those levels build up in the blood. So high values can mean reduced filtration. There are a few common reasons these values can be elevated. Dehydration is a big one. Kidney disease is another. Urinary blockages or other illnesses or infections can also affect these numbers. And in many cases, especially early on and depending on the cause, this can be temporary, not permanent damage. I start to pay closer attention when the values are significantly elevated, when both the BUN and creatinine are high together, or when your pet is showing symptoms like vomiting, decreased appetite, or lethargy. Changes in drinking or urination are also really important here. Those patterns suggest this may be more than a mild issue. On the other hand, I worry less when the elevation is mild, when only one value is abnormal, and when your pet is otherwise acting completely normal at home. Sometimes dehydration alone can cause this. These situations are often temporary, but still worth monitoring. So, what happens next? If your pet has elevated kidney enzymes on blood work, likely the first thing your vet will want to do is check a urine sample. This can give us an idea on how the kidneys are functioning by how well they can concentrate urine. Your vet will also probably want to repeat the blood work to look for trends and then review medications and history. And sometimes they'll recommend imaging. The goal is to understand the pattern, not just one number. So, what should you do? First, don't panic over one number. Look at the full picture: labs, symptoms, and history. Follow your veterinarian's recommendations and ask questions if you're unsure, because trends and context matter much more than a single number. I hope this helped make things a little clearer. If you've ever felt overwhelmed looking at your pet's lab work, you're not alone. I'll keep breaking this down in simple, practical terms so you can actually understand what's going on. If that would be helpful, you can subscribe, and I'll see you in the next one.